Wondering why your eyes are dry, blurry, or super irritated after general anesthesia? Well, I'm going to tell you why and how to take care of it. Stick around. So welcome to the Eye Care and Wellness channel. I'm Joel Hayden. If we haven't met before, welcome. And we talk about all things to do with how to take care of your eyes and yourself for life. Let's get at it. All right, guys, so I'm going to go over the top 3 reasons that I believe your eyes are either dry, blurry, or super irritated, possibly even really super scratchy after general anesthesia. So the general anesthesia didn't have to be from eye surgery. It could have been from any type of surgery that could have caused this. A few of the things you need to know that they do with your eyes during general anesthesia is because the general anesthesia really affects the orbicularis muscle around the eye. Our ability to close the eye well when we're under general anesthesia doesn't work as well as it should. And probably 59% of the time, I believe I saw in a study that the eye doesn't close all the way. And that would, as you can imagine, lead to a very dry, blurry eye, especially if that surgery is going to last 4 hours or more. Super, super irritated. But they know this, and that's why the nurses will tape the eyes closed during surgery. It's not uncommon that even with the eye taped that they're super blurry and super irritated. Why? Well, my first thought is that it's possible that in getting you prepped or after surgery and taking the tape off, something like a mask or anything else could have hit your eye and scratched it and irritated it. I gotta tell you, I don't think that happens very often. These people are super professional and they know they've done this a million times and they know what they're doing. So I don't think that's the issue. There can be the second reason this could happen is that as a patient you may be waking up out of general anesthesia and you rub your eye. You're waking up out of general anesthesia. You don't even realize if your eye's open or closed when you're rubbing that eye, and that very well could be what caused a corneal abrasion or just regular irritation, and that irritation can lead to the blurriness that you have as well. So it could be in one eye or both eyes. But more than likely, if you rubbed your eye when you were waking up and your eye was already open, and it's not unusual, that could do it. But the third reason makes the most sense to me. It's that the eyes just were not closed all the way, taped or not, and that can cause just a lot of irritation. So the best thing to do, if you're noticing that, you've had some type of surgery, you're now awake, you're in recovery, and your eyes are killing you, you probably want to tell the nurse, but you may not even notice it until you get home. And the best thing to do is to go down, pick up some gel drops that are non-preserved. I'm going to throw some over my shoulder right now, maybe this shoulder, and pick them up, put them in before you go to bed and when you get up every single morning for a week because they can be really irritated. And if it's bad enough, call your eye doctor. Your optometrist will know what to do. And I see this a few times. The first time was about 10 years ago, maybe even 15. One of my employees, her daughter had knee surgery. And she comes home and calls me up and says, her knee's doing great. Her eyes are killing her. Why? And I hadn't seen this before, but as I dug into it, I figured out that she probably just didn't have her eyes taped well enough. And then lastly, the other thing that can happen is you could have a reaction to the tape on your lids, and you could have some irritation and lid swelling because of that. So again, call your optometrist if that happens because they'll probably want to see you and take a look. And of course, if you're just had surgery and can't get there, I'm sure they'll give you some tips at what you can do at home. So I hope this was helpful. It was a quick video. I thought it was interesting. I thought it was interesting enough to put it out there because people don't expect to have eye problems after they've had foot surgery or any other type of surgery. So I thought it was an interesting topic, and I hope you liked it. I hope you found it interesting. If you did, hit that like button. Consider subscribing. Until next time, take care.